Hey guys, this is Matt. Welcome back to the channel where I'm going to be covering a 6-month update of another YouTuber's hair transplant. His name is Amir and I already covered him on my channel 6 months ago when he went to Turkey, to Istanbul to get his 5,000 grafts via FUE. It was a Sapphire FUE with additional utilization of hyperbaric oxygen therapy, which he has done. Just one session. What's the point behind all that? Is it scientifically backed and what you can expect? Make sure you watch my first video if you want to find out more about that, because this video is going to be only the update after 6 months. Don't forget to smash that like button right now in this very moment if you are enjoying these regular hair loss and hair transplant related updates coming on this channel. Before we start with the video, this video has been brought to you by GoFiber, which are hair building fibers you can use to mask any thinning or patchy areas on your scalp to make your hair look thicker and better. So make sure you check out the link in the video description below where you can visit GoFiber, get a free sample of your choice and try them out. See if you like them. Hey, welcome back to the channel. Good to see you everybody. My name is Matt and I'm your host on this channel where I talk about things like how to reverse your hair loss, how to avoid the being bald for life path, although it can be your choice. Some guys like it, but some guys like you, maybe not. You want to maximize the thickness of your existing hair, you want to grow it back, you want to reverse that hair loss cost and time efficiently and eventually bring that hair to the next level with a hair transplant, which again, you want to avoid many mistakes when getting a hair transplant. You want to maximize the success of that hair transplant. So these are the topics I'm discussing frequently and regularly on this channel. So make sure you subscribe right now and hit the bell if these topics are relevant of high interest to you. Okay, now let's start with the video about Amir, who is 24 and he has done his first hair transplant with 24. It was a fairly large session, 5,000 grafts FUE without additional utilization of body hair, which normally clinics do with these large FUEs. They rarely go with 5,000 grafts FUE only from the scalp. They usually add at least like 10 to 15% beard grafts if the patient has them for additional crown coverage, for example. But in his case, they just worked with scalp hair.
I want to share with you all the updates that happened from month 5 through 6, as well as some of the things that I faced, the challenges I faced throughout the process to get to this point. At month 5, I was just waiting in for some of the density to fill in on my hairline, as well as to get some density in the middle and see what kind of coverage that we can get.
So this is again his hairline by the 5th month mark, and as you see here guys, he was completely bald on his edges, by the way, here on his corners, as you can see here. So this is the hairline after 5 months, the left side, and this is going to be the 6-month mark.
Get on the crown. Now I don't have any hair fibers, or this is 100% naturally my hair, you know, my hands are clean. I have no hair product in here right now. To give you guys a closer look, you guys can probably see my hairline is actually filling in very, very nicely. Like this was not there before. Maybe some more density up here would be nice, Alright guys, so before we wrap up the hairline discussion and move on to the mid-scalp crown area and eventually the donor area of Amir, I would like to say that the hairline is looking good. It's looking natural. I didn't find any double grafts in the hairline, although I would love to see more high-resolution photos, not videos, photos, where we could zoom in and see precisely. I do see this thing here being an issue, the patchy area, because you know by the 6-month mark I see Amir by the point of diminishing returns as far as additional hair growth. And although he mentioned that his clinic or somebody told him, or some statistic he read, that some pretty crazy hair growth should appear between the month number 8 and 12 after the operation, it's usually not the case guys for the hairline, especially for the hairline or temples, where grafts usually start already sprouting by the month number 4 and 5, which was actually Amir's case. I mean, if we take a look where he's coming from, I mean, this was like the peak of his shedding. This was the month number 2. So here we can see that this guy lost pretty much 80%, like good 80, maybe to 85% of his grafts by the month number 2, as you can see here. Then if we go to the month number 3 and take a look at his hairline again, we already start seeing growth.
right? We already start seeing growth. Look at that. So it's clearly new growth already by the month number 3. So he's actually quite an early grower from my experience. And yes, I have seen hundreds of results over the last 4 years, guys. Guys that I consulted, guys who are DMing me every week on Instagram with their results and progress and so on, my emails and so on. He's actually starting experiencing growth on the hairline by the month number 3 already, and this is month number 5, what you can see here, and this is before, that's the peak of his shedding. So this guy has already pretty good growth. This is 5th month update, and this is the month number 6, what we can see here. So this is not a big difference in my opinion. Let me know, guys, what you think in the comments below. I see this guy being already at this point of diminishing returns. This is the month number 6, as I already drew it. For some guys it can be already month number 5th and a half, month number 6 and a half. It can be like 2-3 weeks plus or minus, but I would consider the month number 6 to be like a golden point of diminishing returns, and I would consider like 80% of hair growth for the 6-month mark by most of the guys on the hairline, not on the crown. Obviously on the crown it can go even past 12 months. After 12-month mark you can still get good regrowth on the crown. So we are only discussing the hairline right now. So I expect with Amir more hair growth on the hairline, maybe additional 10, 15, maybe 20% over the last 6 months all the way to the 12-month mark. And if one area of your hairline is not going to fill out the same dense way compared to the other side, you know, you might have experienced that as well. It's not really uncommon even by really good clinics or like the top-notch doctors, unfortunately, and it can always happen, and then the patient needs to come back for correction or adding more grafts to that patchy area, which obviously should be for free. And we're talking about maybe 150 grafts plus minus here, which would already save that situation. But let's not jump into conclusion. We still have 6 more months to go. I'm just sharing my opinion based on my experience and experience of hundreds of guys that I've seen, and we'll see how it goes, of course. Let's wish him the best for now.
As far as the density up right here on my Midscalp goes, it's filling in very nicely. It is pretty difficult to see right through my scalp. To show you exactly how bright it actually is in this room, let me turn off this light, and literally it goes all pitch dark. The hair that was transplanted up over here also slowly starting to grow in, which means now that when I style my hair with pomade or other hair products, I have a lot more volume and a lot more hair to work with, which helps me achieve a better hairstyle overall, which is a great thing.
Well, as far as the mid-scalp, as we can see here by the 6-month mark, it looks definitely much more thicker and fuller compared to the peak of the shock loss, as you can see here. And it seems like the shock loss probably grabbed up some of the native hair as well, despite Amir being on finasteride and minoxidil for the whole time. Probably it also harmed the native hair a little bit because it really looks very thinned out over here. As far as the crown area, I'm not gonna say anything about it because it's still way too early to, you know, even evaluate the crown area result by the 6-month mark. And also he got only like 1,000 or 1,200 grafts transplanted on the crown area itself, which is quite large as far as the balding area. So I don't even expect like huge result or something tremendous, you know, going on there even after 18 months. So we'll see about that. Let's give that more time. But now I'm very curious about the donor area.
Now, with that being said, let me also go ahead and show you my donor area as well. So let me go ahead and turn around for you guys. As you guys can see, there's no major over harvesting.
The donor looks really good. I have to be honest. Yep, definitely good looking donor after 5,000 grafts had been extracted.
Grafts extracted from over here, but you can see that there is no over harvesting or anything like that. The scars are also barely visible because I usually keep my hair.
Yeah, you cannot see the scars from here for sure.
At a 1 millimeter length.
Maybe if he would have shaved all that, and he would zoom in very close, then we would be able to see these white dots because his skin is darker and the dots leave like white scar tissue. So if you are Caucasian, if you have pale skin, the scars tend to be less obvious compared to like if you're Indian or if you are African patient, you know, obviously. So it would be interesting to see it, how the scars actually appear on the skin with Amir, but now it's impossible to see because the donor hair is still quite long for the scars to become apparent. But again, even FUE hair transplant, it leaves scars, it leaves these tiny little dots.
Up to the 6-month point, I was using Rogaine and finasteride to help prevent hair loss and help encourage more hair growth and blood circulation in that area. So we are optimally set up to defend against further hair loss. Those are the 2 treatments I've been doing and kept up with for the past few years since I've discovered my hair loss. One new treatment that I did add into the mix of my hair growth regimen is the Ketoconazole 2% shampoo. I've heard a lot of good things about it, and a lot of people who are facing hair loss have seen great benefits from using this shampoo. So that's one thing that I'm going to be adding into my regimen.
It's a good choice, definitely. I've been using Ketoconazole shampoo for over 4 to 5 years by now, and I also started with the Nizoral 2% one. There are 2 versions of Nizoral 1 and 2% one, and although they're not like marketed as anti-hair loss shampoos, many guys with male pattern baldness see them as such. They're actually marketed, they should be marketed as shampoos against dermatitis and dandruff, because they had been Nizoral. Ketoconazole shampoo has been approved by the FDA for the treatment of dermatitis and dandruff, because it has been shown to be very effective for combating the yeast on the scalp, which is naturally inhabiting the scalp. It's called malassezia, but once it overpopulates, you will experience dandruff and seborrheic dermatitis, and you can treat it with Nizoral every 2 to 4 days, and you have to let the Nizoral or Ketoconazole 2% shampoo on your scalp for 3 to 5 minutes, and then you wash it off. Okay, so that's how you should use it. That's the protocol. There are also many anecdotal reports of many guys who are using Ketoconazole enriched shampoos all over the world, that it actually helps with male pattern baldness, which is caused by androgenetic alopecia, by the DHT, and that's why it's being hypothesized that Ketoconazole may have also some anti-androgenic properties, not just antifungal properties, which help to manage the malassezia yeast and thus dermatitis and dandruff. And it has been then also studied in a study where it was compared to 2% minoxidil, for example, and it has been shown that Ketoconazole shampoo has been able to equally kind of prevent hair loss the same way minoxidil 2% was, and the use of that 2% Ketoconazole shampoo has led to pretty much the same hair density increase as minoxidil. The same proportion of anagen follicles have been improved with minoxidil 2% as with the Ketoconazole regimen, and that's why it has been concluded that the strength of Ketoconazole 2% may be similar to minoxidil 2%. There have been no follow-up studies after that. I don't think it's going to be more potent than 5% minoxidil though. However, it's very important to use Ketoconazole shampoo in your regimen. If you find that the 2% version is drying out your scalp too much, it can happen, especially by guys who have naturally dry scalp. That's something that I found out with myself when I was using Ketoconazole rich shampoo 2% every 2 days. That was too much. Now I'm using a 1% Ketoconazole shampoo from Hair Restoration Laboratories about every 2 to 3 days, because 1% is milder, so you can use it more frequently if you have naturally drier scalp. And if you have oily skin, probably you can get away with using it every other day as well, but this is something you need to test yourself. And yeah, by the way, if you want to check out the shampoo that I'm using, you can check out the link in the description below where you can get 15% off on your order, so make sure you do that. If you haven't used Ketoconazole shampoo in the past, or you want to try out another one which is good and approved, and I've been using it myself for almost 3 years by now.
From here on now, I literally just started using it a couple of days ago. Probably going to be continue using it for as long as, you know, it gives me good results, and I'll share with you guys, you know, what I experienced. But so far, this is one new thing I added into my regimen, and let's see if it makes any difference.
In conclusion, I would consider Amir's hair transplant a success by the 6-month mark. Obviously, there are some areas which still could fill in. I'm really happy for his toner. It really looks nice for 5,000 grafts without additional utilization of the body hair. It really looks good, and I'm surprised about that, so that's really positive. And as far as his crown, we will see. As far as his next update, I'm going to probably provide you the 12-month result. And with that being said, thank you so much for watching this video. Make sure you smash that like button and subscribe. You know that Matt is also helping guys with their hair transplant research and helps them find the right hair transplant doctor, helps them evaluate different alternatives, gives them recommendation, gives them advice, gives them honest feedback on what to expect before their hair transplant. This is all I'm doing during one-on-one consultations. So if you want, you can sign up and apply for a consult, which then I'm going to schedule with you a video call over Zoom about 48 to 72 hours later from the time you applied. You can do it on my website. You can check out a bunch of my hair transplant related guides on my website, like best hair transplant clinics in Turkey. This year I also visited like 8 or 9 new clinics in Turkey, which I researched. Some of them are in my guide, some of them are not because they were not good enough. I'm constantly on the search. I'm constantly researching, talking to doctors, technicians, and seeing the results, seeing the practice of different clinics. And this is also all in my collection, Best Hair Transplant Doctors in the World, which you can also get, and a bunch of useful guides on how to properly research your clinic. You can join our free Facebook group, Hair Transplant Experiences, with over 3,300 members in the group, where you can get also opinions from other guys in the group going through the same as yourself. So make sure you do that as well. It's called Hair Transplant Experiences. And with that being said, thank you so much for watching. Again, smash that like button, and I'm going to be seeing you soon with another video. Take care.